Welcome to Entrepreneurship Vertical, Design Thinking and Human Centered Design. The fifth unit, completely case study. First three units we covered design thinking process, start from problem definition, we have ideation. After ideation, we have a prototype, testing, sometime evaluation. Now we are coming to human centered design, particularly concentrating for human being feedback. After prototyping, we have interactive research. Based on the interactive research, we are implementing some feedback decision. So we have interaction and interactive design thinking. Based on that, continuous improvement is possible in the human-centered design. Here we have a case study, particularly impact of alcohol addiction. Now, in the case study, focus particularly in the public. What is the impact of alcohol addiction? This video lecture covers definition, then statistical detail about our country. Then we have particularly the effect of alcohol. Due to alcohol, what are the human effect, particularly in the physical, social, then what are the issues are rising. Now we will see the definition. Alcohol addiction has a wide range of determinal effect, including increased risk for various cancer, liver disease, and heart and brain damage. The problems start in different effect, particularly cancer, liver disorder, heart and brain damage, significantly harm social life, leading to relationship problem, sometimes violence, even it goes to accident. The impact of particularly severe, particularly on adolescent age, it affect brain development. Even for all age group, it can lead to impairment and mental health issue like depression, anxiety, and physical problem. So it weaken the bone, increase the infection risk. So various issues occurring due to the problem of alcohol addiction. Now we have some statistics. Based on that we will come for the effect of alcoholism. Now different state, the percentage of population above 15 years, the percentage of people in overall India, the percentage of people above 15 age group in the survey, the overall population 9.91 percentage of people taking alcohol regularly. The percentage in Tamil Nadu 12.27, Pondicherry 13.37, comparatively with Kerala coming around 9.49, Karnataka percentage 8.62, Andhra Pradesh 11.55, Telangana 24 percentage, Maharashtra 7.27, Madhya Pradesh 9.12, Odisha 16.13, West Bengal 9.35. Now Tripura, Meghalaya, it's between around 16 to 19 percentage. In Gujarat, percentage of alcohol consumption is very less, 3.25. Rajasthan, it's around 5.63. Delhi, 11.53. Haryana, 8.45. Chandigarh, 9.85. Jammu Kashmir also very less percentage, 4.56. So overall, considering these, now the percentage is very low in Gujarat. Now we are considering Andhra Pradesh is 11.55, Tamil Nadu 12.27, Pondicherry is comparatively higher, 13.37, Kerala it is around 9.49. So the evaluation of all those things, the overall percentage of people above 15 age taking alcohol consumption around 9.91 percentage of population. Now we will see the statistics in the other kind. Alcohol consumption in India in the year, we start from 2016, 5.38 billion liter is consumed in the year 5.38 in the year 2016, increasing in order 2070 5.56, 2018 it's around 5.94, 2019 it's around 6.23, in the 2020 it's 6.53. The percentage is in increasing order only. This much billion liter consuming in India. So what is the effect we will see in the later side. Based on the consumption, we will assume people taking more in quantity. Now we will see the another statistics. Alcohol per capita per person, how much quantity in liters they are taking. In per capita, while considering from 1990, we have female per capita 1 liter, male 2.8 liter. In the time duration shifted, the consumption, individual person consumption is increasing in order. 1 liter is increasing into 1.5 to 3.1 for women. Male, in the year they consumed per person 2.8 liters means here 4.3 in the year 2010. 2017 it is increasing into 5.9, 2030 maybe assuming 8.8. The total alcohol consumption per candidate 4.6 in 1990. In the year 2010, 7, 2017, 9.6, 2030 estimated 14.3 liters. So consumption also increasing in order. That is a major worry. The public consuming alcohol, that is more in quantity. Now coming to death due to alcohol. In the year 2009, 4 point, sorry, 4,483 people death in the year 2009. 10 it is increasing 4,886. 2011 it is around 4,547. 2012 it is around 5,478. Here 2013 5,518 only because of alcohol impact. Every 96 minutes we are losing one person due to alcohol. This is a conclusion of this slide. Now we will see some effect, how it is affecting in our body. We will have physical and mental health care due to alcohol. What are the problem raising? Effect of alcohol on the body. First, because of alcohol, immediately affect in the eyes, blurred vision. Now, immediately brain damage and even stroke. This is the reason for alcohol. Stomach ulcer, heart disease, irregular irregular beats of heart, increased risk of cancer, liver disease mostly occurring due to alcohol. We have disease in the liver in four different stages. First stage in the liver, they are taking much food, it is converting into energy level. Now, there is a more consumption of food, the energy is not transmitting, it is stored in the liver as a fat. If it is not utilizing, the fat is above that liver, it is in layer. Keep on storing around age 50 to 60, it is not properly utilizing the layer, particularly the layer fat makes lot of issue. What are the problem raising? Even it is not utilized, it is not converted into sucrose and glucose. That fat react with the cells of liver, it will make lot of damages. Because of that, that layer of fat make lot of issue. The problem raise, the problem due to fat, that is called initial stage fatty liver. If it is continuously moving, the fatty liver is affecting the cells in the liver. It will make lot of damage. After that, it is converted into cancer problem. So major uncurable issue in the liver is cancer. It starts from the fat. By the by, if the person is taking alcohol, the fast damage is possible in the liver. So the problem brain, stomach, heart, increasing risk of cancer in the liver. These and all possible effect of alcohol. Now we will see the major risk in cardiovascular disease. Alcohol is linked to high blood pressure, stroke, even ending with heart disease. Now, liver disease, chronic use can lead to fatty liver. We explained such a nicely fatty liver, inflammation, and potential fatal cancer. Alcohol consumption increase the risk of several cancer, including liver, heart, even neck. The brain damage is a major issue due to alcohol. The brain damage, long-term use of alcohol can damage the brain, affect the memory, decision making, and it will coordinate the, particularly for adolescent, it increasing lot of issue. Now we are coming to social and behavioral impact, accident and injuries due to alcohol. Alcohol increasing the livelihood of accident, injury, sometimes major violence. So that's why the government of India giving punishment, drink and drive, imprisonment. So mental health in association with the increased risk of depression and anxiety. Because of consuming alcohol, there is a major risk in depression, social and financial problem. The people taking alcohol can lead to their fail to maintain personal relationship, working and the school problems are starting from the alcohol consumption. The major issue even in the finance also. Risk-taking behavior, increasing risks are unsafe, unplanned. Everything is possible because of this alcohol. Now coming to the long-term effect of alcohol on the body. Heart, increasing blood pressure, enlarging heartbeats, irregular heart rate. These are the major problem. If you are taking continuously alcohol, shrinking of muscle, that is a major issue in the case of taking alcohol. Skin reduced, the attractiveness in the skin is coming down. In the liver, cancer problem, hepatitis, these are coming because of alcohol. Hormonal imbalance are possible for particularly ladies. When you considering a brain, the brain damage, memory loss, sometimes even confusion because of taking alcohol. The pancreas, due to alcohol continuous intake, the swelling is major issues. Increasing change of infection due to alcohol. Stomach ache, sometimes bleeding, inflammation, so ulcer in the body because of the continuous taking of alcohol. Now, what we want to conclude here, alcohol, reason for alcohol, why the people are taking in the age group, adolescent age, what is the attractiveness of that alcohol. So we have a impact as well as we discussed many things, particularly in the statistical report. Per person alcohol consumption how much? Due to alcohol, how many people per year death rate? Every 96 minutes, one person is go for death due to alcohol consumption only. Based on this reason, we will do many centric design, human centric design based on the alcohol addiction. Next lecture, video lecture, we will consider reason for alcoholism. When the people are attracted by this addiction, alcohol addiction. So why they are taking alcohol? These are the major human centric design. Then how to cure from the addiction side, how we will take the people into next level. These are the major issue in our country. One more thing is very important. Now the people in our India, our country population is high. The population is high, the same time between 20 to 30 age group is more in our country. Based on that statistics, the workman power is high, the human being, that means our wealth is our human being. With that, if you take a properly, the habit is very important. The power of the country is based on the human being. If you are taking into right path, we will take our India is a more economical country. For that, without alcohol, the country 0 percentage consumption of alcohol is we want. We want alcohol completely removed from every state. How it is possible? What are the things we need to take? Many consequences are coming, but we need to attract non-alcoholic. So the reason for alcoholism we need to identify based on the continuous human-centric design. First, we want to stop. That's why we take initiative in the colleges, even schools, the awareness of drug and alcohol. Based on that, we can completely eradicate, completely remove the alcohol-based problem. This video lecture giving little impact about how many people are suffering, what is the effect, social impact of alcoholism, physical and mental health effect, everything we discussed in this video lecture. Next lecture, we will see the reason for alcohol addiction. Thanks for your patient listening. Thank you.